Thank you, Chair. Honorable Chair, we firstly wish to recognize the work of Dr. Tembekwayo to bring this bill before the committee. We, however, support the report by the committee. The ACDP notes the important issue of access to healthcare and the expansion of healthcare services at the primary care level that the bill seeks to address. Primary healthcare facilities such as day hospitals or clinics are at the forefront of healthcare and disease management. The quality of healthcare is greatly impacted by the long waiting hours at these facilities, the shortage of staff, the lack of security, and the lack of appropriate infrastructure to ensure the comfort and safety of patients, especially the elderly and those suffering from illness. To change this, there are two critical elements that must be addressed: the ability of the state to perform and execute what is needed, and the environmental readiness to facilitate the change of extending service hours. It is evident that the biggest hurdle to transformative and quality healthcare is the deficiencies of the state. This is not primarily a lack of funding or even on the ground capacity, but that the state insists on controlling the sector and dictating to communities concerning their healthcare. The key reason we do not turn the money invested into healthcare by the taxpayer into healthcare outcomes is the state's desire to control healthcare. We cannot constantly be saying we don't have money to open clinics when communities need them, or pretend that funding does not matter. The state needs to dissolve power to communities to determine how their needs are best served and when they want clinics open. We want to see a model, especially in rural communities or areas with high population, that reduces pressure on the system. What is needed to make the shift possible and thereby improve services and access to quality healthcare is what requires a further deep think and consultation before legislation that extends service hours can be developed and implemented. This legislation needs to form part of a fundamental reform of the healthcare system, and no, Honorable Jacobs, we do not support the NHI. As long as the state dictates healthcare centrally, it will demonstrate its inability to create a conducive environment to pursue improvements and transformative healthcare services that will improve South Africans' experiences at healthcare facilities. Thus, we conclude with the committee that the bill is not implementable or desirable in the current circumstances, but would welcome working with Dr. Tembekwayo and the whole community to create a community-led healthcare. Thank you, Chair.